I'm going to touch a little bit on vaccinations because it is a controversial subject at this time. So I'm not going to give any opinions. I'm just going to provide you with some information based on what the Center for Disease Control, the CDC, is saying and suggesting, and also just strict research, research-based information. After that, we will get into some naturopathic ways to help boost your immune system and lower your risk of actually getting colds and flu. And we'll talk about what happens if you do end up getting a cold or flu, or your loved ones, what you can do to help ease the signs and symptoms that we suffer through when that happens. So, who here has heard of naturopathic medicine before? Awesome. So a lot of you are familiar. We do have very similar medical training as medical doctors. However, we also have training in nutrition, physical therapeutics, hydrotherapy, counseling, botanical medicine, and homeopathy. What we try to do is address not only the person behind the disease, but the root causes of any disease that they might be suffering from at that time. We'll look at lifestyle factors, nutritional factors, metabolic factors. We can perform laboratory diagnostics just like any other physician can. So that's basically our foundational training, and then we come out into the world to help you all. So, is that the next one? Yes. So some facts on the flu. Colds and flus are very similar in their symptoms, but flus tend to be a little more serious, and they linger a lot longer. They both can be, they can both give you congestion, runny nose, sore throat, cough, achiness, fatigue, possibly fever. You generally have these problems for 3 to 5 days, sometimes much longer, and sometimes residual issues from it, like bronchitis or other bacterial infections, can also make the recovery much longer and give you additional symptoms. Both are caused by viral infections. There are many different viral infections that cause both colds and flus. We try to keep track every year of the changing viruses for the flu, and one of the reasons that we do that is to be able to create more effective vaccinations. Vaccines are, however, pretty controversial, and we'll talk about why that might be. And again, there are lots of different things that we can be doing by ourselves at home without any doctor interference to help reduce our risk of getting sick. And if we ignore the infection when we do get it, things can get really serious, and we'll talk about some of those warning signs. So this year's flu is way milder than last year's flu, at least so far. Headlines this past week, compared to last year when I did this, there were like 12 very dramatic headlines listed, but flu season is just starting to become widespread across the United States. And so we have it in almost half of the country now being reported to the CDC. And we have, if you see here in our little week ending the Christmas week, in Connecticut, the reporting was widespread. So we do have the contamination here, and there is a higher risk for us to be dealing with the flu. However, if you compare it to last year, 2017 to 2018, you see a big red spike going up, and that is much beyond the epidemic threshold. If you look at 2018 and going now into the 2019, this is all updated information, and we're still waiting to get through these weeks, but we have not reached any epidemic proportions. So again, it's not as contagious so far as last year's flu was. One of the reasons for this is the type of flu strain that we have going around this year. Most commonly, it's the H1N1 as opposed to the H3N2 that we had going along last year. There are still some cases that we're finding to have H3N2, but it's not in this region at this time. So this is one benefit for the vaccination argument. The H1N1 flu is better treated or has a higher efficacy of prevention than against the H3N2. Last year's vaccination was around, I think, 10 to 20% effective at preventing the flu. And this year they're saying it's more about 40 to 60% effectiveness at preventing the flu. So in that way, vaccines are a better choice this year than they were last year. However, there are still some things to consider about vaccinations besides the efficacy of them. And one of them is the fact that these vaccines don't just have the bug in there that will train your immune system not to get sick anymore. There are a lot of additional ingredients that you have to be aware of. I'm sure a lot of you have heard of mercury being an issue in vaccinations, but it goes a little further than that. There are many adjuvants that are added, and what are adjuvants? It's a whole bunch of different types of ingredients that help stimulate an immune response in your body. So not only are we giving you those bugs or that protein information about bugs, but we're putting in a few more other factors in there to make the immune system pay attention and say, hey, look at this information, this is an issue, get dramatic about it so you don't forget that when you do get this bug, you will have a reaction. So in a way, adjuvants are very helpful, and we need them to elicit that kind of response. But at the same time, there has been plenty of evidence that shows that these adjuvants can also cause autoimmunity and a hyperimmune function reaction to other things, including our own tissues and cells. And that's where things get a little questionable, whether or not it's worth having this vaccination in your body. So one thing that I do want everybody to do is find out what flu vaccination is being offered to you, and then find out what ingredients are in there. And do your research to see if those are safe and if they have any sort of evidence that they're causing autoimmune diseases. So I just pulled a few different research articles from some published medical journals. And this is Frontiers in Endocrinology. This, I'm just going to read a few little quotes from the abstract here. Adjuvants are agents that entail the capacity to induce immune reactions. Adjuvants are found in many vaccines and are used mainly to increase the response to vaccination in the general population. Systemic sclerosis, systemic lupus erythematosus, and rheumatoid arthritis have been reported to be induced by several adjuvants. Clinical cases of Hashimoto's thyroiditis and subacute thyroiditis were observed after the exposure to vaccines. So, how many of you know somebody who has a hypothyroid issue? It's really common. I see it a lot in my practice. And a lot of the time we have to ask, well, what's stimulating this autoimmunity? Because that's exactly what Hashimoto's thyroiditis is. And a lot of the time hypothyroid issues are actually a Hashimoto's autoimmune issue that's causing it. So it's very common, and this isn't something like autism that we're worried about. At the same time, it's other things that our healthy adults otherwise will be getting with normal vaccination schedules. So this is from the Pharmacological Research Journal. Vaccines and autoimmunity are linked fields. Vaccines are given to previously healthy hosts who may have never had developed the disease had they not been immunized. In this review of the literature, there's evidence of vaccine-induced autoimmunity and adjuvant-induced autoimmunity in both experimental models as well as human patients. There are several case reports of autoimmune diseases following vaccinations. However, due to the limited number of cases, the different classifications of symptoms, and the long latency period of the diseases, every attempt for an epidemiological study has so far failed to deliver a connection. Despite this, efforts to unveil the connection between the triggering of the immune system by adjuvants and the development of autoimmune conditions should be undertaken. Vaccinomics is a field that may bring to light novel, customized, personalized treatment approaches in the future. So we are becoming more aware that these things are happening. This was published in 2015. One of the big problems that this study is pointing out is that because these autoimmune issues can take a while to show themselves after the vaccine, a lot of people may not be making those connections. And because people's immune systems will respond to them in different ways, not everybody's going to have the same exact symptoms as, for example, if everybody was getting sick from the mercury. Mercury poisoning has very widespread similar results in people, where autoimmune problems are very individualized to each person's immune system. Here's one from the Journal of Autoimmunity. Is this the same one? Yes. Factors entailing an immune adjuvant activity, such as infectious agents, silicone, aluminum salts, and others, were associated with defined and non-defined immune-mediated diseases. Relating to the current knowledge, we would like to suggest to include these comparable conditions under a common syndrome called autoimmune syndrome induced by adjuvants. So this is a journal who suggested that we should start creating an umbrella term for these sicknesses that they're starting to notice are related to the adjuvants involved in the vaccinations. So all of that is a little stressful to think about because it really does come down to the risk factors involved. Is my immune system strong enough to handle the things that they're going to be putting inside of my body? Am I going to personally respond to it well? Do I have predisposition to autoimmunity in my family? Do I have heavy metal toxicity already? These are all things that you want to consider before going to get your vaccinations. And again, you want to be aware of the ingredients. There are a whole bunch of different vaccinations out there. Quadrivalent, trivalent, nasal sprays. They're all being considered equally helpful by the CDC, and they're equally recommended this year to use. So you have your choice. So I would do the research and decide which one fits the best for you and your family if you decide to go ahead and get it. Either way, there are things that you can do naturopathically to help either intensify the results of the immunity that you're hoping to get from the vaccinations, or to help improve your chances of not getting the flu even without having a vaccination. So we're here to kind of empower you all in your own health through education and also by helping you build your bodies up so they're empowered enough to help themselves as well. So the first step is prevention. Just like getting a flu vaccine would be a prevention, there are other things you can be doing to help prevent sickness. And this is generally speaking even, not just with acute colds and flus. This can be considered prevention practices for autoimmune disorders in general, for chronic diseases like diabetes, like cancer. All of these things will help you be more balanced as a human being. So happy moods, we all know happy moods release neurotransmitters and actually are anti-inflammatory for our body. They help us handle stressors better if we're in a good mood. I'm sure everybody knows that their threshold for handling their day very much depends on whether they're feeling good and they're in a good mood or if they're cranky. Daily activity is very important for a healthy immune system. There are plenty of studies out there that show that 30 minutes of activity every day boosts your immune system function significantly, and that's not just against invaders into your system, but again, it's also, it will fight tumor cells that are starting to turn tumorous and things like that. A healthy diet gives you the nutrients that you need to feed your immune system, to feed your liver, detoxification pathways, to keep everything flowing smoothly, and to keep you well nourished. Adequate rest is important. You can be doing everything else perfectly, but if we're not resting and restoring ourselves every night, we're going to be depleted, and our immune systems show that very easily as well. Hygiene is important. If you're not washing your hands, if you're sneezing into your hands, or letting your nose run everywhere, you're going to be spreading diseases to other people, and you're going to be more likely to be giving them to yourself as well. And the supplementation that we're going to be talking about today is strictly towards improving your immune system to prevent infectors. So we're going to first talk about herbs. Adaptogens are herbs that you can safely take every day. Basically, as long as you take it at appropriate doses, you can do it long term. And what it does is it will balance your body wherever it needs to be balanced. If you are hyperactive in one place, it's going to relax it. If you are underactive in another place, it's going to help boost that and just bring you into a homeostasis. So a few of my favorite prevention herbs are astragalus, ashwagandha, eleuthero, rhodiola, and schisandra. I will tell you that if you're having hypothyroid issues, astragalus should be avoided because that does tend to elicit a Hashimoto's response if that's something that you have a penchant towards already. Elderberry syrup. Who here has heard of elderberries? Okay, awesome. A good amount of you. They're incredible. They are highly antiviral. I'll show you a study or two as we continue on. but they are great for prevention, and they also treat virus infections. So even if you already have it, it will still be helpful to take it. They're full of antioxidants and a bunch of other herbal components that really help your immune system do its job. Green tea is also very antiviral. It supports a healthy metabolism. You need to have several cups a day for it to be able to be effective on the medicinal level. Licorice is another one that I say it's good for some people in that it's highly antiviral and helps support your adrenals. However, if you have hypertension, you do want to avoid licorice as you have an increased risk of making that worse. Ginger is anti-inflammatory and antiviral, and that's something, fresh ginger is what I'm talking about here, not like dried ginger tea bags or anything like that. But it's highly antiviral as well and anti-inflammatory. Fire cider, who here has heard of fire cider? Okay, a little less. Fire cider is an apple cider vinegar tincture, basically, where we brew a whole bunch of other pungent root herbs, horseradish and garlic are two of my favorites to put in there, cayenne. And basically you let it sit for a while, you strain out all of the herbs, and you have this very pungent, we call it fire cider because it's hot and it feels like it slaps you in the mouth when you take it. But basically that's what it's helping your immune system do to the bad guys too. It's like a punch and a kick to the bad guys. It's great for stomach acid, it's great for digestion, it's great for detoxification for your liver, and it boosts your immune system significantly. So fire cider as a prevention, and again as a treatment, also it can clear congestion nicely. There are several herbal formulations that naturopaths tend towards. EHB is homeopathic that has a lot of, EHB is not homeopathic. Oscillococcinum is a homeopathic that helps with the flu. EHB is an herbal formulation that's excellent at boosting the immune system, and it's also antiviral, antibacterial, and BioVeg is very similar to that. It's just a different blend of herbs. As far as foods go, these are things you can find in your kitchen every day, and you can just go a little heavier on if you already take them, or you can start adding them into your diet and exploring different tastes and combinations in your kitchen that you normally wouldn't have done otherwise. Antiviral foods include garlic, onions, ginger, shiitake mushrooms, and honey. Citrus and kiwis are high in vitamin C, and everybody knows vitamin C is important for the immune system. Leafy greens, root veggies, nuts, and seeds are all high in minerals that are important for the immune system. And we need some healthy fats. There are a lot of fat-soluble vitamins that are crucial for proper immune system functioning, as we'll see in some evidence that we'll talk about later. But you can find those healthy fats in things like cold water fish. Usually you want to get those wild caught as opposed to farmed. Different kinds of nuts and seeds are also rich in minerals, and but not only do they have the minerals, they have those healthy fats in them. Probiotics, like fermented kefir, sauerkraut, kimchi, and brine pickles, also do help confer some immunity and support your proper immune function. So things that you could consider taking from a more supplemental level versus the food level is cod liver oil. That has the fat-soluble A and D in it, and it also has EPA, omega-3s. All of those things are very helpful for the immune system and anti-inflammatory. These are the common themes that we'll be talking about this whole time. Multivitamins and multiminerals are something to consider, but I'm not going to throw any specifics out here. You should be talking to either your nutritionist or your naturopathic doctor about what would work for your individual case, because there are nuances there that should be honored. Antioxidants and bioflavonoids, these you can find in those super healthy foods, the superfoods, the vegetables, the fruits, the nuts, the seeds. Also many herbal teas will have those antioxidants in them and bioflavonoids. And what those do is, again, they protect you. They give an extra barrier against stress of your cells that make them break down when you are sick. It gives you a little more stamina to fight your fight. There are many different mushrooms out there that are known to affect the immune system in very helpful ways. The host defense formulations are my favorite. Paul Stamets is a mushroom guru, and he's been doing a lot of amazing research, and the host defense formulations are his medicine. So the mushrooms provide these antioxidants, vitamins, and minerals that we were talking about. They also activate, strengthen, and direct the immune system via cellular signaling. So it will create pathways. It will push your body's different specific pathways against infections versus autoimmune versus cancer. So you can't just take any mushroom. There are different mushrooms that do different things, but they are all very helpful in manipulating your immune system to your benefit. Colloidal silver or silver-psyllin. Silver has been shown to be antiviral. I prefer to use silver-psyllin over colloidal silver. It's made by one company called Designs for Health, and they've done a lot of different research on it, and I'm just going to read you a little bit quick information about silver-psyllin. It's been shown to provide a whole host of health benefits, from killing drug-resistant bacterial strains to inhibiting viral replication, as well as stimulating stem cell production. It can be safely used both orally and topically with no known side effects. Silver-psyllin technology has the ability to inactivate viruses at the DNA-RNA level. Incomplete segments of DNA, RNA are found in viruses and carry a slight magnetic charge. The silver in silver-psyllin acts like a magnet, attracting these charged particles and binding the DNA so tightly that it inactivates the virus and prevents virus replication. This same mechanism of action does not take place with healthy cells, as their thicker, more protected cell membranes carry a balanced charge which protects them from the silver's magnetic attraction. So I've been using this in practice only for the past 6 months or so, and I've been finding a lot of excellent effectiveness with it to the point where I'm using it. It's different from colloidal. It's actually, the formula is silver 4, oxygen 4, and it creates this one free electron that kind of goes and recycles and gets reused, whereas colloidal silver, basically each of the silver particles get used only to kill one silver particle, kills one bug once, and then it's done. And it has to be expelled from the body. Right. So the silver-psyllin is a lot more potent in that way, and you need a lot smaller of a silver dose for the antimicrobial effects. So it's much safer. And
Can it be brewed at home too, the same as you could with colloidal silver?
No. It's manufactured specifically. It has a patent on how it's created.
Does that have a longevity as opposed to colloidal? Colloidal theory.
It does not fall out of suspension from the molecular structure that it's in. Yeah, so you don't have to shake it or anything. It stays where it is. You had a question?
Is silver-psyllin given through prescription?
Yes. Yeah. Any more questions? I will say you can also get it through natural, like if you were to go online, I'm sure you could find silver-psyllin, no problem. But it is smart to just have your healthcare provider, whoever it is, to just let them be aware that that's something you're taking, and you give them the dosage. So it's a lot wiser, in my opinion, to have it administered under the direction of a doctor. Yeah. Okay. Any more questions so far? Awesome. So that's the deal on silver. And then honey, I mentioned in food, but I'm also going to mention it as a supplement. Because it can be taken either way. You can add it to, your baked goods. You can add it into your glazes for your meats. You can put it in your teas, or you can just take a spoonful for its antiviral and antimicrobial effects. There's also a lot of other nutrient value to honey that we're not going to get into, but it supports your immune system as well.
Is that also, like I know with colloidal silver, they recommend you have a small amount of fat when you take it? Is that the same true for?
No. Yes.
When you take the honey, though, you're supposed to do the local honey, right? Correct?
That technique is more so to prevent allergies or to gain resistance to the seasonal allergies in your area. If you're using it as an anti-bug measure, Manuka honey has the most research on its effectiveness against infectors. However, I believe that your local honeys, not only would you be supporting an important industry, but it's just that we don't have studies done on our local honeys to prove that they're just as powerful, is my view on that. So yes, local honeys would be great, but again, it's just a slight nuanced difference in why you're choosing that versus another honey. Does that make sense? I feel like I gave you a lot of information in like 2 minutes. So yeah, local honey, because it contains all of the elements in our local environment, it will train your immune system to be more resistant to the pollens that are out here in our environment. So allergy-wise, that's great. But if you're just using it to kill bugs, to kill virus infections, to prevent bacterial infections or address bacterial infections, Manuka honey is a type of honey in New Zealand that has a lot of scientific studies done to show that honey does this. So responsibly speaking, I would say that would be the technical honey you would want to look for. However, it's just that we don't have millions of dollars to test everybody's local honey, and those bees aren't doing too much different from anybody else's bees as far as that goes when they make their honey. So most likely your local stuff will be just as antiviral. Good? Okay.
Now, with the fermented naturals, does it get by the stomach, the acidity in the stomach? And the big deal with
Yes,
probiotics,
because it's also giving you prebiotics in there, and it will give you if your body breaks down those bugs, it will give you the building blocks of those good bugs once it gets to your intestine.
Which supports
Right.
the gut bacteria.
So yes, so probiotics are, if you have the right kinds of probiotics, we all have tons and tons of bacteria all over our bodies, and within it there are more bugs on and around us than there are our own cells, which is pretty crazy to think about. But they make up our body more than our own cells do, so it's important to be aware of which of those bugs you're kind of helping feed. So when you have the right bug balances, they are actually an excellent barrier against infections. They not only physically are addressing the infectors themselves by not giving them the space and the resources, but the right kinds of probiotics actually talk to our immune system and give us nutrients that feed our immune system in order for it to work better as well.
Do probiotics actually fill in or provide the mitochondria?
That I couldn't speak to.
If anything has ever come up, I've never seen anything about that.
I don't know. I've not heard of that before.
Yeah. I mean, you have up to 4,000 mitochondria. Your heart cells have up to 4,000. These are little energy creators.
Yep, all the more reason to keep your CoQ10 as you age, right? Okay, so here's some studies on some of the natural interventions. So this was a study about elderberry extract dealing with several different strains of influenza. I mentioned earlier the H1N1. It's influenza A that we're dealing with there. There's A and B. But regardless of whether it's A or B, the elderberry relieved symptoms an average of 4 days earlier, and the use of rescue medication was significantly less in those receiving the elderberry extract compared with the placebo. Elderberry extract seems to offer an efficient, safe, and cost-effective treatment for influenza. So we know already that it is a preventive, but now we're seeing that if you get the flu, despite that, just keep on going with the elderberry. In fact, I tend to have people double or triple their doses when they're actually sick, because it will act as an antiviral and help kill that flu along with your immune system. So the next study here is about vitamin D and the antiviral state. Vitamin D deficiency may confer increased risk of influenza and respiratory tract infection. And cell culture experiments support the thesis that vitamin D has direct antiviral effects, particularly against enveloped viruses. However, not only is it killing bugs by contacting them, it's feeding our immune system to be able to do its job too. I see vitamin D deficiency very commonly in my practice, and a lot of the time when I'm seeing that vitamin D deficiency, I'm also seeing chronic infections, which to me tells me that their infections are pulling their vitamin D stores. It's like if you have a whole bunch of soldiers who need a bunch of artillery, that vitamin D is the artillery. So if you're always going and needing more ammunition, you're going to run out eventually. So you need to keep on giving your body that extra ammunition for it to be able to keep on working, because it will exhaust your resources otherwise. Yes?
I'm going back to elderberry. Is it safe to give to children?
It is. Elderberry is safe for children, for pregnant women.
So, you said the dosage for an adult was what, 1 teaspoon?
So for prevention, 1 teaspoon 1 to 2 times a day is a good adult dose.
And how about for toddlers?
For toddlers, you want to do more like a quarter to half a teaspoon.
Yeah.
Yes. And the biggest risk factor that you have there is giving them too much sugar. That's in the, yeah. Yeah. Any more questions?
Thank you.
Yeah, no problem. Okay, so key points from some meta-analysis research about vitamin D. I just wanted to put it all up there because I couldn't pick like just one thing to say. So I'm just going to read it all to you. People who get influenza are more likely to have low levels of vitamin D. Vitamin D can help reduce inflammation caused by the influenza virus and increase the number of antimicrobial proteins that fight against the viruses, and those antimicrobial proteins are your immune system. Influenza infections increase during the winter, which is when vitamin D levels are known to decrease in the population. So we're wondering, like, hey, if we didn't have the sunshine in the summertime that gave us that vitamin D, would the flu season be then too? Is it just the fact that we have higher vitamin D that we're protected and the flu kind of gets suppressed during those times? Some experiments have shown that taking vitamin D supplements can reduce the chances of getting the flu. Having high levels of vitamin D might help decrease recovery time if you do get the flu. And some researchers recommend higher vitamin D levels to protect against the influenza virus. I like to have people's levels between 60 and 80. This research is suggesting between 40 and 80 in your blood. And if you do get influenza in general, and this is for adults, you can safely take high dose, which is about 50,000 IUs a day for 5 days to try and fight off the infection. But you shouldn't do that long term. It's a very short term thing, and you should be doing this under the care of a doctor. We're going to get into some information about plants. And this was a research study done in 2009 that showed essential oils of aromatic plants have antibacterial, antifungal, antiviral, and cytotoxic properties. And I'm not just talking about like Young Living doTERRA essential oils here. Essential oils are found in your tea bags. They're at much lower levels, but those are also much safer levels, and they're also effective. When you pour yourself a cup of thyme tea or oregano or something and you smell that herbal smell, all of those are the volatile oils and essential oils that are coming up. Those are all medicinal components that are leaching down into the water and then are also steaming up. So this study showed that there are, in fact, mechanisms that are attributed to these oils that can give us that antiviral support. So what is this? Do I have this in here? Yes. Effects of probiotics on prevention of common cold. This was in a meta-analysis where they showed 10 studies within 7 articles giving a marginal effect of probiotics on the prevention of the common cold. Results implied that probiotics had a modest effect in common cold reduction. So this is showing that there are a lot of research publications coming out right now showing that probiotics may not be effective. However, this meta-analysis of multiple studies show that it is, at least as far as protecting us from the flu, an effective practice. So, you do all these things, you eat healthy, you're not going crazy on the sugars. I did not put that in the slides, but I will tell you that eating high amount of sugars or carbs every day will suppress your immune system as well. And deplete you of important nutrients that your immune system needs to protect you. But you did everything else right, and you still got sick. So what do you do when this happens? So first of all, I'm all about people healing themselves, treating themselves, keeping their sickness to themselves, not going out to a doctor and getting everyone else sick on the way there. But it's also really important that you're aware of when you do need that medical intervention and when you should not be dealing with this yourself, when you should be going and getting some expert help. And those red flags are more common in the youngest kids and the oldest people. Anybody with an immune issue or immunocompromisation all of those things, you should be looking for these signs a little more carefully and maybe be a little more sensitive to them. But if you have a fever over 104, that's not going down. That's definitely something that you need to get dealt with. If somebody is starting to act weird or disoriented, or it's you who's sick and you're feeling disoriented, that's not okay, that's not safe, and you do need to go to the hospital, and somebody should drive you if it's you who's feeling that way. Obviously, if somebody's unresponsive, that's not something that garlic is going to help, and you should go to the hospital. Severe signs of dehydration, which is beyond thirst. You're going to notice that their skin puckers, you're going to see really dry lips. Fluids are really important to push when you're sick, but if there's any sort of dehydration or if they're vomiting and they don't want to drink, they should go to the hospital for fluids at the very least. Signs of respiratory distress, which means if they don't seem like they're breathing properly, if they're breathing too fast, too shallow, or slow, those are all problems and they should get checked out by a doctor. Or of course, if somebody's coughing up blood, then that goes beyond normal flu pathology, and that should be checked out as well. So, that being said, if you have just your normal chills, aches, headache, feeling miserable, stuffy nose, what can you do for these things? You want to limit your carbohydrates, limit your sweets, because your immune system already was repressed enough to get sick, and eating these sugars is only going to feed the infection and repress your immune system further, and that's going to keep you sicker for longer. What you do want to be having is stock bone broth, soups, organic vegetables, not fried or anything like that. You want them baked, boiled, steamed, soft, mushy, kind of like baby food stuff. Sauteed mushrooms are okay. Lots of garlic and pungent spices will help clear your congestion and fight the infection at the same time. The other thing about having congestion, you want to make sure that it's clearing, because if it's dripping down into your lungs, if it's hanging out in your sinus cavity, then you do risk feeding bacteria all that good gunk, and you might get an infection, pneumonia, bronchitis, sinus infection, all of those fun things that nobody wants. You definitely want to rest. You definitely want to keep your germs to yourself. Try not to, call the team over to help you. Just have like 1 or 2 people if you need the support, and sneeze into your arm. Do not touch anybody. Keep yourself, be aware of how contagious you might be, and honor the people around you. There is a concoction that I like to use of short-term high-dose vitamin protocols, but again, this needs to be done with a doctor. I didn't give dosages, and I'm not going to give dosages unless you're a patient and we talk and agree that it's safe for you. But vitamin C, vitamin A, vitamin D, NAC, which is N-acetylcysteine, and selenium are all excellent to help thin the mucus secretion, support your immune system, and wipe out that virus. And again, just a reminder, you really want to make sure that your sickness is within the range of safety at home, and always consider if you should be getting further help. If it's all stuck in your head, if you're feeling the congestion and you're not getting any sore throat or lung pathologies in there, then you want to do things like herbal teas. You can do steam inhalations. Who's heard of steam inhalations? Okay, so basically what the practice is you take a big boiling vat of water, and you're very careful with this. You put it on a table, and you put a cloth over you. Now, what you add into the water depends on what you have in your kitchen at the time when you're sick. You can add a few drops of essential oil, but it's a very small dosage, or you can put a whole bunch of kitchen herbs in there. I have a few listed here that would be great for the head congestion. Thyme would be great to put into the water. Oregano would be great to put into the water. Echinacea is something you can drink as a tea that would help stimulate your immune system and fight off the infection. So eucalyptus is excellent at opening up, clearing congestion and opening up your respiratory passages. Feverfew helps stimulate circulation, microcirculation, and it helps you dispel any sort of hot, fevery sensations you might be having as well. And the majority of these herbs do have an antiviral capacity to them because of those oils in them. So other things that you can do for head colds, who's heard of the wet sock treatment? Okay, there's a handout in the back if you're interested to have it. I will tell you that I had a cold over the winter break and I just couldn't get myself to do the wet sock treatment. And now I have a newfound empathy towards people who don't want to do the wet sock treatment. But basically it's most effective if you do it 3 nights in a row. And it's cold socks on the feet after you warm them up in like a hot foot bath or a nice shower, and wool socks over that, and you hop in bed. So it's low key, like it doesn't take a lot to do, but you will wake up with dry feet, and in general, it clears congestion in the chest, in the head, and it stimulates your white blood cells to clear up any infection that might be causing that congestion as well. So again, the instruction is in the back, and that you can do at any time. You don't have to tell any doctors.
How does that work? I mean, like, what's the...
So it's hydrotherapy, which is a modality. And I'm not sure, but we're not sure exactly what's going on, but it's a kind of reflex vascular change that happens where your body does different constriction and relaxation, and it just stimulates the blood flow to go where it needs to go, and it helps the lymph flow. And when the lymph is flowing the right way, it brings more immune system components to the tissues and clears away all the stuff that the immune system is trying to clean up.
Yeah, but you would think that you have a cold, you don't want to be putting on cold socks.
Yeah.
You know what I mean? Like,
well, I guess that you could say that's like, well, you want to make sure that your feet are really nice and toasty warm before you do it. So you have the vital heat in the tissues, and then you put the cold socks on. I know it sounds horrible, but it's really not as bad as it sounds, and it works. Yeah. And some people, they'll do it for 1 night or 2 nights, and they'll be like, oh yeah, it worked great, but then I stopped, and then I started getting congestion again. Like 3 nights in a row seems to be the golden ticket as far as that goes.
I've heard of people doing onions in the socks.
Yeah, I have heard of that. I don't tell a lot of people to do that, so I can't speak to its effectiveness. But there's, a theory that it pulls toxins from the feet. I'm not sure.
Nebulizer be effective or useful?
If you have, not for a head cold, no.
Not for head cold.
No.
That's more for the lungs, then, I guess.
Right. So if you have a sore throat, what can you do to get to that sore throat and help soothe it? Well, obviously, warm teas going down your throat feel good when you have a sore throat, and you can add extra medicinal value to that hydrotherapy by adding herbs that are very soothing and demulcent and anti-inflammatory to the tissues. So marshmallow and slippery elm are 2 of my favorites. I tend to go more towards marshmallow nowadays because slippery elm comes from a tree that does have something called Dutch elm disease going around, and so they're not doing so hot. And so we want to keep the healthy trees alive and not take their bark to make slippery elm powders. There are a bunch of different herbal throat sprays out there that kill the infection at the site, help soothe the lymph tissues there, the tonsils, and also help soothe and numb the throat as well. And licorice, again, if you have hypertension, no licorice for you, but otherwise it's another very soothing and demulcent herb. Who's heard of the throat coat by, I think it's Traditional Medicinals? Yeah, that has licorice, that smooth, soft feeling it has. That's the licorice in there that's really making it feel nice. So tea is one way. Lozenges is another, that you're sucking on something and it's slowly releasing the medicine down into your throat. There are lozenges that have zinc and elderberry to help your immune system. There are lozenges that have the marshmallow and the slippery elm to help coat the throat. Sprays, I have this mushroom spray that I like to give people for throat infections. And the wet sock treatment would still work in this case as well. If it gets down into the lungs, this is when it gets a little more serious, and this is when you're playing with the risk of a more severe bacterial lung infection. But 2 herbs that I really love for the chest are eucalyptus and thyme. Eucalyptus bronchodilates. It opens up all of the passageways like I mentioned earlier. And thyme not only is very strongly antibiotic and antiviral, but it actually encourages all of the little cilia that help move gunk out of our lungs and up into our throat to cough up. it helps hyperstimulate them. So they're pulling up all of the extra congestion and mucus so it's not sitting there feeding bugs. If you have a wet cough with this infection, there are a few different herbs that work better for wet coughs, and that would be elecampane, horehound, osha, thyme, and ginger. They tend to dry up the secretions. If you have a dry cough, you want to soothe those tissues, and that would be with wild cherry bark, coltsfoot, plantain, marshmallow, and slippery elm. There are also, like I mentioned, some great homeopathic combinations and some great herbal combinations that will also be addressing those root causes of inflammation and repressed immune system. And again, wet sock treatments work here. Steam inhalations deep into the lungs will work here. You're bringing medicine straight to where the problem site is by doing that. And teas. So again, with the flu, you want to treat it based on the symptoms that you're having, but be on gentle alert for red flags. If otherwise you're a healthy person or the person who's sick is a very healthy, vital person, it's a little less of a stressor there, but if you're dealing with an elderly person or an infant, this is going to be something that you want to be on high alert for. Flus do have that higher tendency to fever, body aches, and overall feeling lousy. If you're feeling that chill and the achiness, yarrow is excellent. Peppermint, elderflowers, boneset, and lavender all help kind of disperse that sensation. And again, wet socks are great, but if you have the flu, it's better to be minimal on your nutrition intake because it's more serious. Your body's in a more basically dramatic state of alert, and it doesn't want to spend its time digesting your food. It wants to spend its time dealing with the infection. So I would stick more to just the broth idea and very minimal sugars and fruits and things like that. You definitely don't want to be having like cream in your coffee with sugar that day by any means. And wet socks, again, they're the star. So one thing I do want to say about fever, I mentioned that if you have a sustained fever of 104, that won't come down. That's a big problem. But other than that, fevers are actually excellent devices in our bodies, and we have them for a reason, and they can help us kill off a lot of different kinds of infections and sometimes even tumors. So fevers are not something to be scared of. And if I see myself or somebody who I'm caring for who has a more low-grade fever, I actually do what I can to help enhance or support that fever. So I'll say, go take a hot bath and put a hot cloth on your head and drink some hot tea. Get your body revving, help it do what it's trying to do. It's trying to fry something out of your system, help it do that. So it's better not to, take a Tylenol and say, oh, this fever is scary, or I don't agree with this number on my thermometer, so let me take it down. You're probably doing yourself more of a disservice at that point if it's a low-grade fever. So a lot of people ask me when's the best time to take these things, when is the best time to do these things. In general, if you're getting it in, and especially on a daily basis, just whatever works for you, follow your body's needs and your schedule for the highest compliance. But you might feel pretty nauseous if you're taking a multivitamin by itself with no food. I'd say vitamins, fats, and minerals are generally better taken with food. Not only are you going to be more comfortable, but it does help your body absorb more of those nutrients if you're taking them with some food. The herbs and teas and interventions that are more just for antimicrobial only support antiviral. You want to take those on an empty stomach because you don't want your body to think that it's food. You want your body to know that it's medicine and that it's going out there to address your tissues, not to build them up. And immune-building herbs in general can be taken with or without food. Like I said, it's just most important that you're getting it in. They may be a little less effective if you're taking it one way or another, but at the same time, they're not going to be effective at all if you just don't take it. And it's not going to change how you're absorbing your food or anything. Okay, so as I said, we have the wet sock treatment if you want to grab one on your way out. And this is kind of like what you'd look like if you were to do the steam inhalations. Again, we need to be careful not to burn, not to spill anything, not to forget the hot plate or protection beneath the steam. But this is something you could do for about 10 to 15 minutes a few times a day if you're noticing any of those infectors. And even if you're just having congestion, it tends to clear that up and it soothes your sinus tissues nicely. This is like my favorite picture ever of somebody netting. This is another one that's not for the faint-hearted. You kind of need to be ready to feel like you're getting drowned and get your technique down. It becomes more comfortable with practice. But this is a really great way of clearing stuff out of that nasal cavity, reducing your chance of getting infection there and having stagnant mucus and stuff hanging around. And that is it. So I'm right down the road. Do you guys know where the Waterford Dental Health Clinic is? No? Yeah, it's right on Boston Post, like at this intersection. And I'm in the little greenhouse right next to them. So if you want to come by and check out what kind of everyday herbs and teas to pick up for the winter, you're more than welcome to come. I also have the homeopathic flu nosodes that you can use without any sort of prescription. It's no problem. And if you just want to come by and say hi and talk to my front desk person, Brittany, have some tea. I have books up there that you can rent as well. But yeah, any questions?
Just totally different subject. Have you ever heard of microtherapy? And how does that compare to acupuncture?
Microtherapy?
Yeah,
No.
it's a much lower level of electrical intense. It's much lower level. And I've seen some comparisons to that to acupuncture.
That's interesting. I have not. Anybody else? All right, awesome. Well, thank you so much for coming out, and I hope you all stay nice and healthy and hearty this season.
Thank you.
Very welcome.